Fever with relative bradycardia is seen in typhoid. Blood pressure is difficult to measure in a patient with blood pressure is difficult to measure in a patient with aortic stenosis. Sinus bradycardia is defined as heart rate of less than 60 per minute. Which is the most lethal arrhythmia? Which is the most lethal arrhythmia? Ventricular fibrillation. Ventricular fibrillation. A nurse is watching the cardiac monitor and notices that the rhythm suddenly changes. There are no P wave and QRS complexes are wide and the ventricular rate is regular but over 100. The nurse determines that the patient is experiencing ventricular tachycardia. Ventricular tachycardia. The response to hyperstimulation of vagus nerve is bradyarrhythmia. Vagus nerve or the 10th cranial nerve innervates with the parasympathetic fibers of heart, lungs and GI tract. Hyperstimulation promotes bradyarrhythmias. When hyperstimulated, the left vagal branch predisposes the heart to conduction block at the atrioventricular node. In the atrial flutter, the key consideration is in determining the treatment is in atrial flutter, the key consideration in determining the treatment is ventricular rate. Ventricular rate. Which of the following is the cause of embolic brain injury? Which of the following is the cause of embolic brain injury? Atrial fibrillation. Atrial fibrillation. The answer is atrial fibrillation. Which of the following statement regarding ventricular tachycardia or ventricular dysrhythmia is true? Electrocardiography is the criterion standard for the diagnosis of ventricular tachycardia. Lidocaine hydrochloride or xylocaine is the drug for choice. Hypokalemia, hypomagnesemia and hypocalcemia may predispose patient to ventricular tachycardia. All of the above. The answer is all of the above. The answer is all of the above. A patient in ventricular fibrillation is about to be defibrillated with biphasic defibrillator. The nurse knows that to convert this rhythm effectively, the machine should be set at which of the following energy levels for the best delivery. The answer is 200 joules. 200 joules.